year now using smartphones to do for disasters. Started a little company called ICQ. The device we're calling is the Incident Aid System. And what that does is we've developed with earlier students about 8 months ago for inside a fire. It alerts firefighters in 7 different ways in a fire. And these are the students here that helped me through this. And this program for the last 7 weeks, and the students only worked 7 weeks on it, but worked quite hard, is on the EMS end of it. So 70% of firefighters' work is EMS. So we said, let's do some EMS work, and where can a mobile phone be used in the EMS field? And so what we developed was, so this is me, this is what I've done, and that's the first prototype that I showed at Carnegie Mellon about a year ago. And this was for the fire side of it, but you just pull the phone out of this apparatus, and that needs to, it's a very infant prototype, but it has to be more fire resistant. But you pull it out and then you use it as an EMS, pull it out, do your inspections, pull it out, do your maintenance. So what they've been working on for the last 7 weeks is the EMS end of it. So push-to-talk radio has problems. Talk over problems, inability to connect in structures, multi-channel confusion, accidental disconnection. And so what we're saying is use this, don't throw away the push-to-talk radio because this could be more reliable than the mobile phone in certain situations. But why not use it also? Why not be able to use it in different aspects? So these are just talking about Fugat in Sandy disaster, Hurricane Sandy. This is his statements of why can't we improve the situation that we're in than just push-to-talk radio. And again, this is a deputy fire chief from Massachusetts talking with Erickson, but whoever designs it, whoever gets it built, or multiple buildings of this device will really help. And the EMS end of it now, we said, why can't we improve the EMS end? So the students went and we got them about 15 to 20 different interviewees, user interviews, and they came out with the requirements, software requirements for EMS with very creative ideas and very sharp input. So it's all in prototype stage and requirement stage right now, but it is the start of it, and they did a great job. So I'd like to hand it over to them now and show all the hard work they did.
Thank you, Sean. Well, I will introduce the speakers right now. Meet Edward and me, Oscar. We are part of 2 teams that we were working on the MEM solution. We combined the 2 designs, and I will start with what is the agenda for today. We will go through the goals that we address with this design. We also will see the features that we have, and then finally the benefits. Like solutions for emergency medical situations has particular aspects, like for example, like most of the time the first responders has their hands busy, so you don't want to design a device that like force them to have to deal with a device that they have to carry, so we consider that in mind. So as part of the course, we learned about how to design with a goal on mind. We don't want to build like a device for like every situation, so we focus on a goal. This is how we come up with a goal. We define what's the path in an emergency medical situation, and then we design personas, and then we choose a goal to design with. And our goal was to minimize the time from the alert of the incident to the delivery at the hospital. And we state our goal like early and efficient victim delivery to the hospital. And all the design is around that. So you will see how we solve this situation. For deal with this situation, we come up with some ideas, like for example, use voice-to-text translations to allow to the users of this device don't have to write with their hands, but instead of that, just talk to the device, and this device will do the translation to text and will log the information. We also come up with ideas of taking pictures. That was part of the conversation with Shan and with other currently first responders, to provide more information to about the scene of the accident. Also, this is part of the ideas of the other things. Like we all know that every county, every state, even every station has their own norms, their own protocols and things like that. So this, the future is that the device will be sensible to pick up the right protocol according to the situation and according to the location also of the device. And we think on this like an architectural view, like a continuous feed of the incident information. So every time, this is a collaboratively device, every time someone posts an information about the incident, that information is available for all the responders that sign up for that incident. So that way you collaboratively build the information about the incident without having to interrupt, for example, talking through the push-to-talk radio. And we will see how those features fixed within this path. For example, at this point, we decide that all application will receive an alert of the incident information. Even if you are doing like another task on your smartphone, you will receive a push alert. Also, once you sign up for an incident, you will be able to find the best road to the incident, review the protocol. Those protocols will be based on what type of incident is coming. Synchronize. This is a feature that might not be available for every like department, but we know by Sean that, for example, in the fire in Palo Alto, they have the ability to synchronize the traffic lights. So if you know what is the destination and you trace the road, you can synchronize the traffic light with that. Also, most of us use the QR scanning, and we know that we can record the information of that. For the cases that are patients, incident patients, you can give them a QR and then scan them and get the information about the patient. As I said, the register of vitals and also the log of the information of the incident through voice is also another feature that we have. And this is an important feature, especially when there is need for an extra help from an specialist in a particular type of situation, to be able to call a doctor and establish a video conference with him. And also, one of the things that we find is that the first responders currently lost a lot of time like doing calls to the 3 nearest hospitals. So we come up with the idea of sending in parallel to the 3 nearest hospitals, so the 3 hospitals that was chosen by the first responder, the information of the incident, so they can in parallel respond who or which hospital can take in charge of this incident. And finally, this is a tool for the first responder itself. With all the information we collect collaboratively of the incident, we can help them to generate the report. So now we will see how this, all those futures, all those ideas fit in a real case. We will go through a scenario, and you will see how they fix it. So now I will leave you with Admit.
Thank you, Oscar. I'm Sumit, and I'm going to take you through a scenario which starts at an accident and it ends where the patient arrives at a hospital. So let's just imagine that there is an accident happened and either a bystander or the driver calls 911 and providing the basic information about the incident, that there is a car accident at this place. So at this time, when the 911 dispatcher, they create an incident of it, the paramedics who are at the fire station, they receive a notification on their mobile phone, whether they are doing some app in the some background. We just pop up an alert saying that there is an incident assigned to you, and he has the option to view the incident. So if he chooses to view the incident information, he has the basic information about the incident, like what kind of accident is it, what's the approximate location of it, and as well as the count of victims. These are the information that 911 dispatcher gathered from the phone call made to them. At the same time, since the incident is at the server, so anything that happens, there is the latest log for it. So it also has the information like whether the police has been dispatched or not, or the police is on the scene or not. Moreover, as things move on, the log is going to be updated, so they have the latest information about the incident all the time. So the next thing that comes in the picture is the protocol. So they may like to review the local protocols once they start to move on. And there are already some apps which provide the local protocols for emergency response. So we have the possibility of either choosing one of them, or we can have that functionality in our app itself, which provides the local protocols. So the next thing that comes is to get to the location as fast as possible. And these days, the maps are pretty good. So they have information like navigation. So it takes you through the step one by one, as well as they have information about the traffic. So whether the traffic is good, they can optimize the route and provide you the best information. And this is pretty much available at any free apps that you can use, like Google Maps. So we plan to integrate one of those apps in our application, which can take you to the spot as quickly as possible. So once you are at the spot, what you can do is take a snap, or you can edit some information about the incident, so that this stays at the server. So all other teams or any other person who is assigned to this incident, they have the latest information about the incident. So even the teams, those who haven't reached there, they can see that this is the accident photograph, which is available on the incident. Moreover, it's not just the emergency responders. Even a bystander, he can choose to take a snap and upload it. So the 911 responder can say that, okay, take a snap of it and post it to, or send it to 911. And the 911 dispatcher can link this image to the incident. So all the teams who are working on this incident, they have the latest information about what has happened there. And as you know, a picture is like worth thousands of words, so it provides a lot of information, and it's of great help to the EMS professionals. Now coming next, we have, what comes next is basically the patient information. So once the EMS is at scene, what they want next is, what's the patient information, what's his blood group, what are the emergency contact numbers. Now, technology evolves very fast, and these days we very often see the QR code, the advertisement that comes in the paper. And this is one interesting application of QR code, where QR code get links to the patient profile on a website. So QR code is nothing, it's just an image with some bits of information which your phone can grab and do something. In our case, what we plan to do is to use it for, we used to do it for having a URL link embedded into it. So once you go to that, once you find this QR code somewhere around the patient, like on his keychain or maybe his mobile phone, you can just go and scan this, and that will take you to the patient profile. And the patient profile has information like the emergency contact and what are the medicines he is taking. Now, you will always ask a question that why would someone have a QR code with him, or why would someone have a web page having the information, emergency contact information for it. But we often see like elderly people, those who cannot completely take care of them. The kids often take care of them, and if they are concerned about it, they can have a QR code ordered from the EMS, which has all this information. They can also edit the information on a web page. So this page always stays updated. Also, there are cases where EMS receives same patient number of times. So in that case, they can also choose to provide these QR codes to the patient. They can post it to them, and they can also maintain some of the information. So it's like a patient which went to them first. So they can take care of what the information they had. They can put that on web and send the QR codes to the patient, which he can use so that he can be identified if anything happens to him the next time. So there is a web page in case the patient wants to edit that. He can go to the page and edit that information. Of course, there are security things and all, and we have plans to take care of it. So the next page, my friend Edward is going to take you through all the next few pages here.
So in the next 1 or 2 minutes, I'll take you through the rest of the core functionalities of the system. And I'll stand here. Right now we are looking at voice-to-text registration. And this is important because you realize that when you are working on an emergency situation, your hands are usually very busy. And you can't hold probably if you have a smartphone, you can't use your fingers to type whatever information that you want. So this functionality allows you to just speak into your phone, and everything that you want will be registered automatically by the phone. It's very important. As you can see, if I say temperature 100, that will be recorded. If I say pulse 90, that will be recorded. And then you can transmit that into the server. So as you can see, when the paramedic says victim presents difficulties to breathe, that will be recorded. And then the next one is very important. Call Dr. Wiggers for help. That's actually a command. And in the next slide, you'll see that it's executed. And the paramedic in an accident scene can interact with the doctor. This is very important because probably the doctor wants to see details of the situation so that he can help making a decision. And as our fellow presenters say, an image or a picture communicates 1,000 of information that only text can't present. So it's important for the paramedics or the emergency responders to be able to interact with the doctor. Then next we'll have getting available hospital. This is very important. At times you realize that the paramedics waste a lot of time trying to get the nearest hospital. And an available hospital might not have enough resources to accommodate the patient. So this facility, these functionalities enables you to get the best hospital that has enough facilities. And this is very important because you can see there's a button written route. You just click that button and it takes you to the nearest available hospital. The importance of that is that you don't have to type the address of the hospital. That wastes time. Remember, our goal is to minimize time delivery to the hospital. Then you can get the best route to the hospital. Then finally, at the hospital, there's an important functionality. We count it as a value-added service to the paramedics. We'll go to the next slide and you'll see. You can generate a report by probably just clicking a button. Usually paramedics take a lot of time at the end of an exercise to write all the activities of the operations. This is very important to them. It reduces time. And then we had future ideas. We were thinking of integrating this into this application, but we just want to mention right now that this can be thought of further. We can include group communication among responders. We can include indoor navigation and language translation. This is very important because you realize that in an emergency situation, people are unable to communicate at times because of language barriers. So if we include this, we'll be able to facilitate communication among the responders. So we'll quickly look at the benefits of MEMS. One is hands-free operation. Then the two, as you can see, we have already talked about this. We have easy to share information, for example, video conferencing, real-time sharing of multimedia information. Then finally, you reduce a lot of time. These are the benefits of MEM. And at this point, we'll pause to receive questions from you. Thank you for listening.
Yes.
I noticed one of your screenshots there made it look like perhaps like the video conference you did with the doctor or something. Was that recorded and maintained? There was something up there that made it look like it could have been recorded. those, I mean, as an EMT, you're taught if it isn't written down, it didn't happen, and something later could come and haunt you in court.
Yes.
And so I'm wondering if this stuff is being logged, but an entire log being kept as an individual incident that you can save for later, you know, download it to, you know, a server or something like that as an incident log. And in case something comes up in court, you have the records to bring up. You know, we had these vitals, we took these steps, we were given this advice by the doctor, things of that sort.
Yes, in the generate reports part, you can check the text that it was translated, but you can also have access to the recordings of what you were saying. So that will help you to compare not only for the court proposals, but also to when you are writing your report, you can have that information. Any other questions? Sean, something you want to comment?
Well, they did a great job. There's a lot of that, a lot of the information, they flew through what they did, actually. They did a lot more work. For instance, like language translation is important. Right now in the emergency room I work at, I also work at an emergency room now at El Camino Hospital. There's constantly language problems. And why not use a smartphone and all the translation apps that are available today? Pictures. I mean, we're talking now over cell phones to ERs. Why can't we send pictures? Why can't we use those type of multi-data information? The QR code was an interesting idea from this group. Why couldn't we set up a convalescent home with come into a convalescent home, set up information, set up with developing QR codes for each patient, so then you have patient information. Patient's unconscious, you come in, check the QR. QR codes are pretty secure. So why not be able to do that? Those type of events.
What's the information capability of this? How many bits?
Well, it depends on the protocol. Like you have like 6 or 7 versions of the QR. Like on the latest version, it is able to have to admit 7,000 characters, but they have like very grain fine. It is not like the QR like we are used to. Those kind of QR, they can store up to 160 charts. But if you have a good camera and you point it properly, you can easily store. You can easily use version 4, for example, of QR and store it like 1,000 or something like that.
Okay. Let's see what
Right now, just to finish that, right now, most of the time you use QR like a link to address to another web page. But you can also store a lot of information.
So what also that does is it saves time for STEMI alerts for cardiac. When time is of essence when you get to the ER, you can actually send patient information to the ER before you arrive. That's not being done now. Stroke alerts, when somebody's having a stroke, time is essence. If you can send that patient information, donor ability, do not resuscitate, all this information can be sent to the emergency rooms prior to you getting there. So that time, there's also the possibility, we didn't talk about it here, but we talked about it during the class, taking pictures of driver's license, taking pictures of photo IDs or information of the patient, or I talked to Kaiser about 3 months ago, went to their head technologist there in Berkeley. Why not have the ability to slide a Kaiser card through a slide car on a phone, get the patient information then send it to the ER. So it's just the ability to use that smartphone in multiple aspects. Why not use it as a coordinated tool? Everybody have the same smartphone. All firefighters and paramedics now carry a smartphone with them, their own personal smartphone. None of them coordinated. None of them. This would have to be a ruggedized phone. And again, you could use it for multiple aspects of the job, not just the EMS end of it. But the EMS end of it is where we can really save lives. And time is, like they said, time is of the essence. So.
Okay. Well, thank you very much for your attention.
Bravo.